I am Cindy Throop. I am from the United States, and I'm a big fan of openEHR. I've been a big fan for more than 15 years. I thought we had a really great opportunity with healthcare in the early 2010s to actually leverage open source EMRs and EHRs, whatever you want to call them, and we did not. We chose to spend a lot of money on proprietary solutions and really didn't end up with much interoperability, which was really sad. My background is in a little bit of social services, healthcare, and public health. And now that I'm working in public health, I'm hoping that in the US we can start to leverage both openEHR and FHIR. I'm a big fan of open source, I'm a big fan of collaboration, and I'm a big fan of the openEHR FHIR collaboration, which I assume you all have heard about. Just a quick word about, I have multiple affiliations just to confuse people. I currently work for the CDC Foundation, which is the foundation for the Centers for Disease Control in the US. I work with the Michigan Department of Health and Human Services, the State Public Health Administration. I also founded the Open Health Research Institute. I also work with Medado Health, which has implemented in the US, the first patient-centric electronic consent management solution for the Washington Medicaid Agency. So I do a lot of different kinds of work. But one of the things I'm working on currently is a publication that will be forthcoming at the beginning of 2026, which is basically a maturity model for FHIR adoption. And I'm focusing specifically on FHIR, but I keep pushing to include FHIR and openEHR in everything that I do. But I'm basically working on a maturity model it's basically a technology adoption framework for FHIR that can be applied more broadly, but that will be coming out early next year. So if you want more information, this collaboration piece is like basically 25% of the maturity model is about collaboration. So to start with some key definitions, the first one is just a very generic definition of what is collaboration. Collaboration is basically working with someone to produce something. Pretty generic. And then the second and third definitions are completely made up words, so you definitely don't want to use these in real life. But there's what I call collaboration, which is when people talk about collaboration without actually collaborating, which is something that happens too often. And then there's what I call I can't even say it, collabotage, which is when people talk about collaboration while actively sabotaging like a nod over here, like while actively sabotaging collaborative efforts. So I've been, kind of trying to facilitate collaboration among multi-stakeholder groups for a couple decades, and I think I've pretty much seen it all. So in terms of a collaboration framework and to think about how you can measure collaboration, people just automatically start using the collaboration word, when really what you're talking about, there's about 5 steps total, and there's like 4 steps that precede collaboration. So you have to start with networking, then you get to cooperation, then you get to coordination or partnership, then you get to coalition, and then eventually you get to collaboration. And you can use different synonyms, and obviously people speak different languages, so you can use whatever words you want. Just the point is to acknowledge that there are a number of steps on the way to fully collaborating with people. And so to give the examples a little bit of life, like the first stage is networking, which is basically like you introduce people, like you're at a conference, you're like, hey, I'm Cindy, who are you? What do you do? What are you trying to do? That's just, the first step towards collaboration. And then the second, you have cooperation, where you're realizing that you kind of like this person, you have some similar interests, and maybe you should be working on something together. So maybe you decide to work on a small project together. When you get to the level of partnership, you've basically built some trust. You've worked on one successful thing together, that it wasn't too horrible. So you're thinking, okay, we should work on some more projects together. And then when you get to the coalition stage, you get to the point where you're actually sharing resources, which could be, people's time, expertise, money, whatever kinds of resources people bring to the table, and you're basically either doing or you have come up with a multi-year plan. And then finally you get to collaboration, which is where you have built interdependent systems with shared resources to achieve key benchmarks. So again, when we've heard the word collaboration a lot in the past couple of days, and I think that with openEHR being an open source community, we're all really good at collaborating, but it's just kind of fun to start thinking about what the words actually mean. And then there's different dimensions of these 5 steps along the lines of purpose, structure, and process. So this slide is a little bit full, and it's definitely missing some stuff, but just to kind of give some flavor to, the purpose, structure, and process and what that looks like as you get towards, you go from basic networking, hi, how are you, to, whoops, excuse me, microphone, to actual collaboration. So when you're talking about purpose, when you first start networking, you're just having a conversation and developing some kind of basic understanding. Over time, you start focusing on limiting duplication, sharing resources, like I said, sharing ideas, coming up with a multi-year plan, and eventually having interdependent systems to accomplish your shared vision. In terms of structure, things start out typically pretty non-hierarchical. And it's worth mentioning that open source communities in general are pretty non-hierarchical by design. So that's something that we're not trying to move away from at all. But as you get closer to collaboration, you have more defined roles and more formal linkages between organizations or entities or departments or whoever it is that's doing the collaborating. And you start having things like contracts, memorandums of understanding, maybe you have job descriptions, that kind of thing, before you get to the most formal kind of collaboration where everything is written, documented in policies and whatnot. In terms of process, you've got, you start out with informal communication that gets a little bit more formal, and then ideally you would have clear communication around a shared vision, frequent communication, and as those relationships develop, you have more of a shared leadership and shared communication where basically everyone's communicating the same thing. You're not getting one message from one person and another from someone else. And eventually you get to the point where you've got a lot of, overlapping or like solid leadership, not too hierarchical because we are big fans of open source, and we have high trust and high productivity. So a note about systems and people. Hopefully you can't really see it so great, but there's my artistic representation of systems on the left, which is a bunch of boxes, and some of them overlap, some of them don't. And then there's a little smiley face on the right. Everything with collaboration comes down to people, and people are kind of the wild card. And you can measure collaboration. It's kind of easier to measure with systems change, but you can measure it in terms of human behavior, which is kind of worth knowing that you can hold people accountable for actually having to collaborate and not pretend to collaborate, which sometimes happens. So in terms of collaboration, you have to obviously start out with a shared vision, because if you have 2 different visions between 2 different groups, you're never going to get anywhere. And then information sharing is where things tend to be really painful, which is, I think, we're all familiar with in terms of health information exchange. But also just sharing information between people. There's a trust component. Like, people don't want to share information, whether it's sensitive, proprietary, or whether they think it's sensitive or they think that they own it. People don't always want to share that information. So trust is a huge factor there. So in the real world, I like to use the example of information sharing, because sometimes you ask people for information and they say, yes, here it is. Or they say, oh, sure, tell me more about what you're looking for. I'll help you out. Great. And then you kind of get into this kind of gray area, this kind of like purgatory of people that come back with a different response, like, why? Like, you're basically asking for basic information and they want to know why, which kind of puts you on the defensive. and sometimes people will, not that I know this from personal experience, but sometimes people will, they'll basically say, I'll give you that information, but first you have to do a favor for me. So there's kind of that weird middle ground. And then there's sometimes people will come out and just say no, but more often than not, people will just kind of delay until you give up, or they'll just ignore you, that kind of thing. So this was the same slide as before. So just kind of trying to wrap up here about how to measure collaboration. You have to start with having a vision for what it is that you're trying to get to. And like just using the example of openEHR and FHIR, there's this idea that there, we're in the beginnings of a collaboration. So you have to have some kind of vision of what will that collaboration look like in 3 to 5 years in real life, and how do you come up with milestones to kind of make sure that you're slowly making progress, because you can't collaborate overnight. It takes years, especially if you're starting from scratch. So in terms of measuring progress, when it comes to systems, it's not that hard to measure progress. You can basically look at, contracts executed, the memorandums of understanding, job descriptions, just any kind of written policies kind of serve as some kind of documentation of systems change. It's a little bit harder when you're talking about people and the ways in which they may or may not be helpful when it comes to collaboration. So one of my favorite pieces of advice is to look at patterns of behavior, because sometimes you'll ask for a piece of information and you don't get the response you want, and you don't know, is it because you didn't ask the question effectively? Is it because the person didn't understand what you were actually asking? Do they not have the right expertise to know what you really meant? So sometimes you just don't know if people are kind of being difficult on purpose or not. So I find it helpful to just focus on, the third time's the charm in a way. Like if people kind of will not give you an answer or are difficult like 3 times in a row, then you kind of want to try a different way of doing things. But in terms of measuring progress towards collaboration, you want to talk to people. You can do that formally or informally. You can use surveys, like you were talking about, like the Likert scales of, do you agree with such and such statement about how well openEHR and FHIR are collaborating, just using that as an example. And then also, you ask people open-ended questions about, how has this collaboration gone, what's gone well, what hasn't gone well. And people are pretty good at complaining or basically criticizing things. So that can be a good thing when you're basically looking for feedback in terms of, what kind of course corrections you might need to make. So basically, as you're measuring collaboration or your progress towards collaboration, you always want to be incorporating the lessons learned and kind of, it's like continuous quality improvement, rinse and repeat, essentially. And I'll just say, I'll kind of end things with a couple tips of things I've learned in the past couple decades of trying to facilitate collaboration, is that there's always the issue of financial incentives, which if you can somehow, there's like no easy way to solve that. Like if you kind of need some kind of financial alignment at times to get people to collaborate, and that's sometimes not within your control. I've noticed that when you are working in a very hierarchical environment, your colleague will not give you information, sometimes you need to go to their boss or your boss's boss. Like you literally have to keep going up the hierarchy until you can kind of get the attention of someone to basically get that information. It takes time and it's kind of a pain, but that's one way to do it. And I've also learned that bureaucracy loves bureaucracy. Like working for the federal and state government, sometimes if things aren't going well and people aren't collaborating well, sometimes you have to add more policies, add more procedures, add more detail to people's job descriptions that make it clear that you're supposed to be sharing information. So it's kind of a sad truth when you start fighting bureaucracy with adding more bureaucracy, but it does seem to work. So that is basically my presentation. I might have finished a little bit early.